Hello guys, today I would like to share with you my clinical experience treating female infertility with acupuncture. Let's begin with urinary bladder 22, Sanjaya. I always use a hot needle on this point. Typically I burn at least 5 maxa cones. This point is especially called for when the pulse on the right chi position is weak and felt close to the bone. This point activates the Sanjaya system. Sanjaya governs chi. Hot needle on this point generates more yang chi. This is an essential strategy for dealing with many types of infertility. Yang chi can be directed to break up blood stagnation, tonify chi, or strengthen the kidneys. This point is located on the bladder channel, which is the yang aspect of the kidney channel. Bladder channel governs the yang qi. This is an essential point to break up obstruction in the fallopian tubes. The next point on my list is kidney 3, tai qi. Bladder and kidney channels are connected as a yin-yang pair. So we can needle the kidney point next. Kidney 3 is the source point of the kidney channel. This is where congenital chi emerges. So this point has the capacity to regulate the internal organs. Kidney 3 is used for all diseases of the kidney channel, no matter whether the disease is due to kidney yin or yang insufficiency. Kidney yin is the root of the thick fluids in the body, a term used to describe hormones. Kidney yang is the power behind all the activities in the body. In clinical practice, needling this point treats dysmenorrhea, irregular menstruations, and vaginal discharge. Source points on the yin channels have earth phase affinity. Earth controls water. Choose this point to treat frequent or nighttime urination. Because of the water-earth affinity, this point is also essential to treat infertility caused by diabetes or polycystic ovary disease. Always needle it on patients who suffer from low back pain or menstrual pain radiating into the back. This point is needled contralaterally because it opens into the urinary bladder channel on the opposite side at the area of L4-L5. Kidney channel gives us access to the large intestine channel according to the midday-midnight rule. Large intestine 4, He-gu, is the source point of the large intestine channel. Source points are closely connected to the Sanjaya, and this affects qi transformation functions throughout the body. Large intestine 4 is an essential point that enhances any fertility protocol. Large intestine channel is abundant in qi and blood, thus it has very strong regulating effect on circulation. The classical location of large intestine 4 is between the first and second metacarpals in the fleshy part of the hand. But the whole area of the second metacarpal serves as a microsystem. I like to needle this point close to the head of the second metacarpal and let the needle touch the bone. This point location is called Lingu in Master Dong acupuncture system. Lingu directs the effects of this point towards the lower part of the body. Bones are ruled by the kidneys, so we are telling the body that we want to further tap into the source qi. This point activates the yang qi and promotes movement of blood. Because of its connections to the kidney channel, large intestine 4 is specially indicated for the patients experiencing pain in the lower back on the opposite side. Large intestine 4 opens the stomach channel contralaterally as the yang-ming pair. If your patient has an obstruction in the lower abdomen, such as fallopian tube blockage, ovarian cyst, or uterine fibroids, needle this point contralaterally. If the obstruction takes place on both sides, alternate your protocol from left to right with every session. The third point on my list is liver 3, Tai Chong. Large intestine gives us access to the liver channel by the extraordinary connection. Hand Yang Ming connects to foot Jiu Yin channel. liver 3 is a yuan source point of the liver channel, so it has the capacity to treat all the symptoms of the liver channel. The liver channel circulates around the genitals and enters into the lower abdomen. That is why it is an essential point in treatment of infertility. The liver regulates qi and stores blood. Needling liver 3 allows the body to generate more blood and to harmonize qi. I always needle this point to treat menstrual irregularities, flooding and spotting. It is also an essential point to treat emotional disbalances and insomnia. Many types of female infertility have an emotional component. Liver 3 can be needled through and through to reach kidney 1, a wood point on the kidney channel. An excellent point to treat diseases of the reproductive organs and to calm the spirit. The liver and pericardium channels are connected as the Jiuyin pair. Pericardium 7, Daling, is on my list primarily because of its holographic correspondence to the lower abdomen. Pericardium channel opens the stomach channel through the extraordinary connection. Hand Jiuyin and foot Yangming are connected. Physical location of this point on the wrist grants it access to the lower abdomen, to the region of stomach 30, where the ovaries are located. Besides that, pericardium 7 is also a yuan source point. Pericardium 7 is an earth point on the fire channel. It clears heat signs such as mania, withdrawal, and hysteria. Needling this point opens orifices and wakes spirit, calms the heart and settles will. Combinations of kidney 3 and pericardium 7, as well as liver 3 and pericardium 7, serve to calm the heart and spirit. This is a point of choice for unexpected infertility. Next point on my list is Sanjaya 4, Yang Qi. Pericardium channel grants us access to the Sanjaya channel because they are yin-yang pair. Sanjaya is the source point of the Sanjaya channel. The basic nature of the source points is that they connect to the Sanjaya qi. Sanjaya 4 possesses special characteristics because it is the source point of all source points. It can regulate qi in the entire body. Clinically, it is known to treat malpositioned uterus and diabetes. So this is another important point to treat polycystic ovary disease. In classical literature, a combination of Sanjaya 4 and Zhen 12 is used to treat malpositioned uterus and diabetes. This point has a very powerful effect on the ovaries. You can needle or use direct moxa on it. My final point on this list is spleen 6, San Yin Jiao. We can access the spleen channel through the Sanjiao channel because of the midnight-midday connection. That is, these channels are located on the opposite sides of the biological clock. Spleen 6 is a great infertility point for many reasons. It is an intersection point for all three leg yin channels, spleen, liver, and kidney. This point can regulate and nourish the blood and qi. It also tonifies kidneys. It regulates menstruation and benefits the genitals. It calms the spirit, activates channels, and invigorates blood. You can literally needle it on every person who comes for infertility. A few words have to be said about the 5 phases relationship in acupuncture. Spleen channel belongs to the earth phase, and the kidney channel belongs to the water phase. This is the relationship of control. Would it not restrict the kidney channel if an earth point is needled on it, like kidney 3? Or would it not subdue the kidney channel if you were to open up the spleen channel with spleen 6? The answer is no. You are actually telling the earth and water phases to be nice to each other and work harmoniously. In Master Dong acupuncture, there is a combination of 3 points, the 3 emperors, 77.18, 77.19, and 77.21. These points are located on the spleen channel, and their main function is to supplement the kidney channel. So these are my 7 most important points for infertility. You may have noticed that I selected points in a sequence where each point is located on the channel that communicates with the previous channel. This way I ensure that the chi is moving harmoniously between the points. It is possible but not necessary to needle all the points on both sides. Normally I do needle back shu points on both sides. The rest of the points I can needle unilaterally. It is possible to select additional points in this sequence, but please make sure you follow the same principle of connecting the points according to the channel affinities. For my infertility patients, I always ask them to start charting their basic body temperature at least a couple of months prior to the commencement of the therapeutic program. The BBT chart serves as an invaluable diagnostic tool. Time is of essence. Have your patients commit to the therapeutic program for at least 3 menstrual cycles. Treat them at least twice every week and you are going to see very good results. Thanks for watching. More videos like these are coming, so please press the like button and subscribe. I would love to hear your comments. See you next time.